Hello, today I am thrilled to be joined by Danae Maragouthakis. Dana is a medical doctor with a background in public health and a member of the British Association for Sexual Health and HIV. She's worked in healthcare for 20 years across 4 continents, has a passion for collaborating with driven and diverse individuals to devise new or better solutions that improve lives by promoting health and preventing disease. She co-founded and is the CEO of Yoxly, a venture that provides a range of remote sexual health services through an ecosystem designed to give users more convenience, privacy, accessibility, and control. Hailing from the US, we're very fortunate she decided to make the UK her home for now, at least. Just before we get into the podcast, just want to let you know we'll be talking about topics related to sex and sexuality, with a mind to be curious and to explore how we can learn more about those topics and how we can protect our own sexual, mental, and physical health. You may know the Yoxly Health TikTok channel, which I discovered, which is absolutely fascinating, where the number's probably gone way above this by now, but almost 1 million followers see questions, answers such as how often should I masturbate? Is swallowing sperm healthy? Is it normal for pee to burn after sex? And I'm always very impressed by the very straight face you have when answering any of these questions. And some of the questions are, they're allowed to be amusing. They are, yeah, this sort of thing. Is it okay if those sort of questions? I think it's absolutely fabulous. So congratulations on that. It's really interesting. It's something that my children actually drew my attention to. And I said, actually, I'm talking to her in a few weeks' time. But no, it's really good. So I want to really start by talking a little bit about your background and what helped create the person that came from the US to the UK, and what helped create the person joining us today.
Oh, well, thank you for the lovely introduction. It's a pleasure to be here. So, I mean, you kind of gave me you hit all the highlights in the beginning. So, I'm a medical doctor. I've got a background in public health. You mentioned I'm a member of the British Association for Sexual Health and HIV. But yes, I guess getting a bit more personal. So, my parents are ethnically Greek, but I was born and raised in the States, which is where I completed the majority of my undergraduate, graduate, and medical education. Growing up, I knew I wanted to be a doctor. So from the very beginning, I loved anatomy and physiology. And so surgery became my first passion. And I guess there's something about surgery that is very ritualistic, very repetitive, almost meditative. It's really organized. You're focusing on a single patient and you're going through a series of steps to achieve a target outcome. And so that was my first love and was my focus for the first 2/3 of my life. And then when I came to Oxford in 2015, my surgical senior approached me about setting up a medtech company with him. And it had to do with remote diagnostics and predictive health algorithms. And I was like, oh, well, this is really interesting. And that's when I caught the startup bug. So I never planned on becoming an entrepreneur. That happened entirely by accident. And I suppose during that time, I was working in the emergency department in the UK. And that felt like quite a far cry, I suppose, from kind of the insular walls of the operating room.
Yeah.
And you couldn't get more opposite. In A&E, anything can walk through the door at any time. You're juggling multiple patients, so you're doing several things at once, and there are all of these urgent things that are kind of competing for your attention. And it felt a bit chaotic, but I learned. So, as someone who used to really love the order and the ritual of surgery, I learned that I could also kind of thrive in that type of chaos to improve efficiencies and mitigate risk and implement order. And those are all really good skills to have when running a startup. So I suppose I took everything I learned over my life from surgery, from A&E, from public health, from that first startup I was involved in, and I took all of that and applied it to Yoxly. I suppose, again, I like people, I like learning, I like traveling. I get comfortable with the uncomfortable. So to me, that signifies growth. I enjoy working in teams, which you've already said. But I think teamwork is one of my, I think it's, probably my favorite thing, whether I'm working in the hospital or working with a startup. Sometimes my mind works faster than my mouth can talk, which means I can quickly go down a rabbit hole. I question everything, and I don't do it to be annoying, but I do it because I refuse to accept the status quo. I have what they call an immersive personality, which means I can get hyper-focused or fixated on details. But that kind of I guess I don't want to call it obsessiveness, but that determination combined with what I call my pathological optimism is kind of what drives me to continue to improve and make things better. So that's a little bit about what makes me tick.
No, it's a hell of a background. It's funny. If I could live my life again and I had been clever enough, I would have been a surgeon. I wasn't clever enough, or it wasn't something I ever aspired to do. But just the thoughts of, yeah, somebody's laying there unconscious. You've got I'm sure better terms than this, but a knife in your hand. You're going to cut into them and you're going to fix something. It's like, I mean, bloody hell! It's just absolutely extraordinary. It's funny because on I guess this is how media, especially fiction, it sort of drives the narratives that surgeons are sort of either quite cold and not very empathic. They just want to be in there with the person. They don't want to talk to the person. They just go in there and do their work, and then a person goes on. It's not really a person as such, and you come across as the opposite to that. So it's really interesting that you had that sort of background. But what role do you think empathy does play in that healthcare space?
So I think empathy is critical to healthcare, and I think it's essential for good clinical practice no matter what your specialty is. So it really transforms the way we interact, not just with our patients but also with each other, so in terms of our medical colleagues. And there's someone called Dr. Helen Reese, and she's, I think, a professor at Harvard's medical school, a professor.
I talked to her a few weeks ago.
Oh my gosh, okay, great. Oh, so you know. Okay.
Oh goodness. Well, but both her and you make me realize that I'm not that clever at all. But yeah, it's she's fabulous. Yeah, that episode will come out in the next few weeks, hopefully.
Oh my gosh. Well, okay. So you already know what she says about empathy, so I won't repeat. I won't spoil it for the listeners. And she can say it far more eloquently than I. But she agrees. She listed all the things that empathy does to improve kind of like clinical practice, improve health outcomes, adherence to treatment recommendations, patient-provider interactions, like quality of care. The list goes on. But I think, which is interesting because medicine is really the study of humans, right? And it's both an art and a science. The science stuff is fairly straightforward, right? Because it's kind of underpins, what we do in terms of preventing, diagnosing, and treating disease. It's like scientific principles. But then the art bit, I think, kind of comes from understanding people beyond just their anatomy and physiology and really starting to see them as a whole person, understanding their fears, their motivations, their hopes. And it allows us to really connect and listen in a way that means we can help them more meaningfully. So I guess some of the best doctors I've ever worked with, whatever their specialty, didn't just treat the condition, they treated the patient. They listened and they supported and they guided people through their health journeys with compassion. And so I guess, I don't know if that answers your question. But
it does, and I'm not sure what necessarily the research shows, but it's fair to surmise if somebody goes into surgery feeling they have complete trust and faith in the doctor, they have complete belief in what's happening, they're fully aware of what's going to go on, you would sort of think or feel that potentially promotes a better outcome. And it probably doesn't sort of scientifically, but you sort of think, well, if I'm going into this feeling positive, all those positive vibes and everything goes well, and when you come out of it, you think, well, I'm sure that went well, I'm sure everything's fine, as opposed to feeling, my goodness, wasn't really sure going in, what's it going to be like, how am I going to recover, feeling negative. So you sort of think that absolutely that holistic view of things really does have an important role to play in healthcare outcomes, I think.
It does. I think surgeries, anxiety, like sexual health, it can be an anxiety-provoking experience, right? It's high emotion. And so anything you can do to, allay the concerns of another person and just kind of, set expectations and make them feel heard, that goes a long way.
Yeah, definitely. I mean, my only personal experience of surgeries with my son when he was maybe 4 or 5 weeks old, he had a thing called pyloric stenosis, which for people that don't know, I think it's basically the food goes in but doesn't. It's sort of, there's a blockage in the stomach basically, and it wouldn't come out. So he had to be operated on when he was 4 or 5 weeks old. And the surgeon performed it. Everybody said, "Oh, he's a great surgeon. He's really, really good." But he didn't have a great bedside manner. But his junior, or whatever they call it, working with him, was so good and so kind and took us all through it and was very sportive and said, "Look, he's brilliant. Don't worry." And it was absolutely perfectly fine. And Alexander's 15 now, but just a tiny scar now, and that was it. But yeah, when you don't have any experience of something like that, it's kind of scary, really. And the same with sexual health, when you sort of notice something or somebody else notices something and you don't know what it is, you do want somebody that's going to talk to you with knowledge, but with empathy and with understanding and all those things. You don't want to go to somebody and feeling judged, which I think is where the Yoxly solutions are so powerful, that it takes away that element of fear, or it takes away some stigma that you might think somebody feels. And is that part of the reason that you set it up?
Yeah, so I suppose the idea for Yoxley had been burning in my brain for quite a while. So
Okay.
I've worked in a lot of different places around the world in healthcare, and everywhere I went, I saw healthcare, particularly sexual healthcare, I should say, was quite fragmented. Nobody seemed to do it particularly well. There was still a lot of stigma. It's a bit of an awkward subject for patients and also for providers. I got my master's in public health in Philadelphia, and I wrote my thesis on the health disparities and resiliencies that existed within the transgender community there. And I was like, oh, here's a group of people who's having really open conversations about their sexual health, because oftentimes their needs aren't being met by conventional medical practice. Usually they're educating their providers. Then a few years later, I was working in Oxford in the emergency department, and I was seeing lots of patients come through with late stage complications of undiagnosed and untreated STIs. And I thought to myself, well, that's weird, because healthcare is technically free at the point of access here. Why aren't people accessing services? And so then we sat down and tried to identify some of the barriers to access. And with Yoxley, one by one, we tried to design an experience that would remove those barriers.
And when people get the results from Yoxley, do they then take those to their medical professional, or does Yoxley carry it through, or how does where does Yoxley fit into the journey that somebody I think I might have an STD or an STI. Okay, Yoxley, great, I'll do that. Where does that fit into that sort of journey?
Well, I should say so. A lot of people don't realize that STIs often don't have symptoms. So they can have infections for months or years where they are passing it on to others and then increasing the risk of developing chronic complications themselves before it's ever diagnosed or treated. So that's the first thing. But people are still very reactive when it comes to their sexual health rather than proactive. So, like you said, they'll get tested if they have a symptom. They'll get tested if they've had, the condom broke, or they had an experience where, they felt they were at risk. But generally, it's not something people tend to do kind of like as part of like an annual MOT. Now, if someone is concerned, or if they just wanted to get screened annually, or depending on their level of activity, it might change their frequency of screening, but they can go to our website, they can order a test kit. If they don't know which test kit is most appropriate for them, we can recommend one for them. Then it gets delivered to their home in a day or two in discreet packaging. They can take their samples at home on their own time, using the instructions that we provided, and then they post their samples with any Royal Mail postbox back to the lab. And then we keep them up to date the entire way. So whether it's letting them know that their kit's been dispatched, or their samples have been received, or when their results are going to be available. So we try and keep them informed in the process. Because again, it's really anxiety provoking when you're waiting for that kind of stuff. And so then within a day or two, the results are uploaded to a secure online portal where, depending on what they've tested positive for, we can issue treatments through our partner online pharmacy, and that can also get delivered to your door. Or if they don't qualify, because some infections require in-person follow-up, and so we direct them to the closest and most appropriate clinic where they can seek, professional support, and then they can share their Yoxley result with another healthcare provider. So we do our best to create a service that not only it follows all best practice standards and all the guidelines, so that it's something not only patients can have confidence in, but also healthcare providers. Because there's nothing worse when somebody like runs into the department, they're waving a piece of paper like, "Oh my gosh, I got this result from the internet," and you're looking at it. And I was like, this result, I assure you, you'd be dead if this was the result. So I assure you that's probably wrong. But like without the context and without the reassurance and without explaining to them, not just like this is your result, like this is the diagnosis, but this is what it means. This is how it's caused. Like this is what treatment looks like. This is where you can get that treatment. So we do our best to I guess, reduce potential sources of anxiety or concern that people are already going to be experiencing because of the nature of the testing we do.
I hadn't necessarily thought of what we'd said then about the fact that people tend to go to a sexual health clinic when they notice something, is not necessarily something we consider doing as on an annual basis when we change partner, when something's happening in our lives, really. Well, this is a terrible example, but I hadn't realised maybe sort of a year or so ago that my blood pressure was super high. It was like, I don't know, 190 over 110 or something. And I had no symptoms whatsoever. And I didn't know that. I was going to the doctor, said, oh, we should check the blood pressure while you're here. Checked it. And in the same way, so whenever I go to the doctors now, they check blood pressure. So you sort of wanted to get to the stage where actually when something happens, either annually, new partner, whatever, just get this checked. It's
Yeah,
not, there's nothing about it. So yeah, that's what we need to do, really, isn't it? Persuade people that it's just part of an annual health check or a periodic health check, or there's no, just because you're being tested and checked for something, it's just like being tested and checked for cholesterol or for blood pressure or whatever. And
exactly.
yeah, it's just getting away from the fact, or someone's getting away from the fact that it's sexual, which is not. It's not at all. It's physical, really. It's not sexual. It's just a physical thing. So it's getting people to think about it as a regular part of their health maintenance program, like
I
brushing,
mean,
whatever.
what's so
Yeah.
interesting, forgive me, I didn't mean to
Yeah.
interrupt. Oh, I was going to say, what's so interesting about sexual health is that, like, traditionally, the way we thought about it, it was either the presence or absence of a disease, right? You
Yeah.
either do or don't have a diagnosis.
Mhm.
And actually, we know that sexual health is much broader than that. So the World Health Organization defines it as a state of physical, mental, and social well-being that enables people to have, safe and pleasurable sexual experiences. And so traditionally, we focus so much on the diagnostics, but by considering people only in the context of a diagnosis, you
Mm.
miss a lot of the key psychological and social things that, I guess, underpin behavior and that are important determinants of sexual health. So actually, it's the sexual health. I think there's been traditionally just so much focus on the medical side of things without taking a look at the whole person. And
Yeah.
that's what else Yoxley. So we started with sexual health testing because, I'm a doctor, that's what we understood.
Yeah.
We said, okay, well, the STI rates are rising. Can
Mhm.
we pick it up sooner? Can we prevent transmission? And then we realized people don't know much about sexual health. So it was like, okay, we have to create educational content. And it became clear to me that after a few months of creating content on social media, that I could reach and help more people in a few months than
Yeah.
I could if I worked in the hospital every day for the rest of my
Yeah.
life. And that was incredible.
It's a very important distinction, I think, that we're not talking about sexual health, infections, or illnesses, whatever we're talking about. And I was talking to somebody yesterday about porn-induced erectile dysfunction. That's one
Mm.
thing I'm talking about. I was talking to somebody yesterday about the menopause, and there's lots of things throughout our lives, things that are either natural or things that either we've engaged with that affect how we perform sexually. Whether as a woman we feel we're lubricated or we just don't feel mentally in that space. Whether as a man we've spent so much time looking at porn that we just don't. That the screen is very different than a physical act, and that affects our performance. So again, this is all sexual health, isn't it? It's not just about the gonorrhea or HIV or syphilis or whatever else. It's the actual. Yeah, I like the way you put it. It's the ability to have a fulfilling and healthy sex life, if and do what you want to be able to do without any issues, really. So no, I like the distinction. And
Yeah.
just on the thing, I was talking to someone about this yesterday, so it felt quite relevant, really. So I've been doing some investigation into social media and particularly the sort of very early and easy access to pornography that children have now. I think the average age that a boy sees pornography now is about 12, I think. And it's very different than when I snuck a look at my older brother's Playboy magazine. And I thought, oh my God, there's a naked woman. Oh my God, oh my God. And this picture might go around the playground until it was literally dog-eared and that was it. That
Oh,
was so exciting. Whereas now, that isn't what 12-year-olds are seeing.
mm.
They're seeing, in a way, and it sounds silly in a way, they're sort of seeing sex without consequence. We don't often hear, well, I don't think I've ever heard somebody talking about safe sex or consent or lots of other things. And people see that before they understand what relationships or healthy sex is all about. And I just wonder what your thoughts were on that.
So it's interesting. So I guess I should start by saying that I don't generally take issue with pornography. If
Yeah.
it's consumed in moderation, it can be a normal and healthy form of sexual exploration and expression. But the ubiquity of pornography has
Yeah.
definitely influenced the way that people experience and view sex.
Mhm.
And so it shaped people's expectations in ways that aren't always healthy. It's created or exacerbated anxieties or insecurities, and that people can have about their bodies, about
Yes.
performance, about their relationships, or even what pleasure looks like.
Mm.
So people don't always realize that pornography is a choreographed performance. But when it's mistaken for the norm,
Yeah.
it has a tendency to cause a lot of challenges, particularly when the real life experiences aren't living up to the fantasy that they built on screen. What's tricky about the demand for pornography, though, is that it's outpaced the availability of reliable and relatable educational resources when it comes to sexual wellness. For better or for worse, it has replaced kind of sex ed. And that's kind of, I feel like this is really the crux of the issue, because it's become a default teacher for so many people, and it doesn't really promote things that are important in real life, like safe sex or consent or balanced relationships, all the things that you just mentioned.
Yeah.
So I think it's a conversation we need to have more openly, without shame or judgment. And so that's what we try to do at Yoxly. So we try to empower people with knowledge and tools to competently navigate their sexual, I guess, experiences, but in a safe and a healthy way. Because
Mm.
porn isn't going anywhere. But
No.
what we can do is we can do a better job of providing context with those kinds of educational resources to help counteract some of the unrealistic stereotypes that are promoted.
Mm. And funny is the right word. It's kind of funny. So I talked to a lady that works in the industry and a porn director as part of this sort of series. And both of them were sort of keen to stress that they get tested all the time.
Yeah.
They get tested all the time, and they tend to date or have sexual experiences within the industry because they
Wow.
know that the people they're with are clean as such of any particular uh, health issue, or whatever. So it's funny. You sort of think, my goodness, you watch it on the screen, you think, oh gosh, but then when you sort of realize how it is exactly as you say, they are actors and actresses. It's something that hopefully many of them have been chosen to go into, and they're doing it. And like you, this is not about the negativity of it. It's just about the ability young people and some adults have understanding what it is showing, and that it is a film in the same way that Top Gun Maverick's a film. Tom Cruise isn't really flying that plane, he's not really shooting that thing, or some Western or whatever. They're not really doing that. This is just the script they're following.
Yeah.
Yeah.
Yeah. But it's about providing that context. And like you said, for people who are, even for more mature adults as well, but it's particularly for young people who haven't had a lot of experience themselves, like, again, it sets a standard, and it's what they come to think of as the norm.
Yeah.
And there's nothing to balance it out.
Yes. You might well assume that it's normal to be with 3 or 4 partners at a time, and somebody comes to the door to fix the washing machine, and the next thing you know, anyway. But
Yeah.
yeah, that isn't real life.
Well, no, and it's interesting because social media, I mean, it's somewhat different, but it can be similar, right? So people can regularly and easily access these platforms where
Yeah.
there are certain stereotypes that are reinforced, and those exacerbate anxieties and insecurities, or where there's a lot of misinformation and disinformation, and that
Mhm.
causes a lot of confusion and compound stigma, and can potentially lead to a lot of harm. And so that's one of the reasons we started putting content out on Yoxley.
Mhm.
Yes, it's like it's got an incredible reach, but also because that this is where people get their information these days. It's on their phones. But
Yes.
but also, there's lots of health content out there, but not all content is created equal. A lot of it's not created by experts. A lot of it's anecdotal or sensationalist or just plain inaccurate. And so how can we combat some of that and like provide factual information in a way that people
Mm.
can understand, and also in a way where they feel that it relates to them and they can access it, because I could spend my whole day in the hospital talking to people, but that's
Yeah.
generally not where they
Yeah.
live.
Mm. And do you find there are common questions you get asked on TikTok in particular? Do they follow certain themes or questions?
Yeah, absolutely. So there's a lot around pregnancy, avoiding it, how to become pregnant. There's a lot around, I guess, physical insecurities.
Yeah.
So am I a normal size? Is it normal for, my genitalia to look like X or to do
Yeah.
Y? How can pleasure is another big one. So how
Mhm.
can I please a partner? How can I, last longer? How do I know that they can enjoy this? Like, what are the techniques I can use? So It's, I mean, but to be fair, the questions span the gamut. I mean, we've heard and seen a lot, but it's we're trying to create a space where people feel safe to ask, where they feel validated, and where they feel less alone. Because again,
Right.
with the stigma and some of the
Yeah.
shame and the fear of asking when it comes to sexual health, it can be really isolating.
You can, and I've got friends and then my colleagues, whatever, that you sort of when if ever the topics of these sort of things come up, if people are talking openly, you sometimes a lot of it seems to be around communication. And I obviously tends to apply to women more than men, obviously. So women that haven't had an orgasm or don't orgasm with their partner, or say, well, do you talk about it? Do you have a conversation? And they just don't. And that's really hard. I mean, that's more of a relationship issue than anything else, I guess. But so much must be down to the ability to actually have a conversation, and that's where I think what you do is so helpful, because then at least they know almost what, not what the norm is, because that's a silly thing to say, but what, well, is it, should I just not have an orgasm? Is that just what people just don't have? Should it last 1 minute, 10 minutes, 3 hours? Well, at least they have a baseline for then hopefully they can then go and take it. Well, actually, or almost slip into the partner's feed, so they're sort of seeing it as well. I think they think it's not as it should be. But no, I think, yeah, communication, knowledge, information from experts is so important, because people will tend to ask their friends, and all you can have is your friend's experience. And if you're a child, you ask your friends at school, and they have no experience, but they will maybe have had experience from somewhere else, and it's like, okay, you just the blind leading the blind here. Really, we need to speak. We need to listen to somebody who knows what they're talking about.
Yeah. And I think increasingly, so yeah, I think it's that, yeah, you're right to say, what is normal, but it's almost like, what is normal for you? Or like just to know that they're not alone. They're not the only person experiencing this challenge or who had this question. And
Yeah.
so I think it's been really rewarding to see the community kind of form organically and people share their experiences from all over the
Mm.
world, and kind of, affirm what somebody might be going through on a completely different continent. I mean, that's been really cool, but it just speaks to the human experience. Sexual health and wellness is a need we have from, if we're young adults to, if we're lucky, the time we die. And so the fact that there's still this reluctance to discuss it, or we treat it as separate from the rest of our health, just doesn't make any sense. But
Mm.
yeah, by having these types of conversations and hopefully normalizing and destigmatizing the discussion and the subject, we can break down some of the antiquated stigma that surrounds it and give people a sense of I guess, community, but
Mm.
also a sense of belonging, so that they don't feel like they're just kind of out on an island, the only person with that problem.
It is funny, isn't it? It is one of the few topics where we don't necessarily talk about it. We tend we You tend to talk, whether it's politicians or people tend to talk about the outcomes of sex. They might talk about pregnancy, they might talk about abortion, they might talk about all the different things that happen, etc. But not the actual, not sex itself. People, you certainly wouldn't. You might get somebody coming into work. Oh, I had too much drink last night. I've really got a bad hangover. Somebody doesn't come into work and say, "Oh, I spent all night long watching porn and masturbating." You just don't, do you? But
No.
it's. Well, I'm not saying you don't, but just generally, it's not. And I know some things you don't want to talk about, but yeah, it feels like a very odd thing, because most people, it's something that they want to have. It's something people tend to want to have a partner. They want to have somebody they're intimate with, whether it's monogamous or polygamous or whatever. As long as everybody's comfortable what's happening, it's yeah. You sort of think it's just talked about so little, and that's one of the things that really surprised me when I looked at watched the TikTok for ages, was the fact that still daily, I think it was said 1 million people get an STI daily.
Yeah.
How
Oh, yeah.
how is that possible when we know, well, we know, and maybe you're going to say, well, we don't know. People have been aware that condoms properly used are protective against most sexual transmitted diseases. You sort of think, well, if you're with a new partner, don't do this, or all those things. It just surprises me that so many people still get these, what can be sort of life-threatening illnesses.
Yeah, I mean, that's such an important question to ask because despite everything we know about safe sex and the advances in sexual health,
Mhm.
the fact that STIs are still incredibly common and that over 1 million of them are acquired every day around the world highlights the difference between knowledge and action, right? So I mean, it's a complex question. I have a few thoughts.
Mhm.
So I think one of them is this, with all these incredible scientific advancements we've made. So right, so we talk about vaccinations for things like HPV and hepatitis B. We've got
Yeah.
better birth control options. We've got game changers like in HIV prevention, like PrEP and PEP.
Mhm.
So these, with the advent of these discoveries, they've inadvertently or unintentionally led to a drop in the use of barrier methods like condoms. And so as a result, we're seeing other STI rates like chlamydia, gonorrhea, syphilis rise. So that's one thing. And then on top of that, we have certain infections that are developing resistance to treatments, right? And so that's a whole nother kettle of fish. Another, I guess, challenge would be the way that people access information. So because of smartphones and the internet, we kind of already touched on this, is that we have
Mhm.
more information than ever before, right? It's
Mhm.
easier, it's all at our fingertips. But not all that information is reliable. And so,
Mm.
and I mentioned previously about how so much of it isn't created by experts. There's misinformation, disinformation, and it's sensationalized. And so I think it was Flow, the menstrual tracking app,
Mhm.
that did a large study, and it revealed that a lot of young women actually rely on social media for their sexual health information, but the majority of them don't fact check it.
Yeah.
So they just kind of take it, at face value. And I guess with absent or subpar sex education happening in schools, again, social media becomes in pornography to a lesser extent, probably becomes the main source of information. And I suppose so. Those are kind of like two very large categories. And then I
Yeah.
was about the issue of accessing not the information,
Mhm.
but the services, right? So the health products and services, getting to a gun clinic, and barriers to things like that. They can be geographical. You might live really far, you might not have a ride. They might be
Mhm.
financial in the U.S. particularly, where it's just too expensive, you can't afford it,
Mhm.
or it can be sociocultural, and that's where the stigma kind of comes into play. People are afraid to be judged or be seen in a sexual health clinic.
Mhm.
And even when they can go in, I think it's often an inconvenient process. You have to take time out of work or school and go down there, and you have to wait, and then you're waiting for results. And so it can be overwhelming. And, even these little challenges to accessing care or sexual health care in that way can become an insurmountable hurdle.
Mm. And is it? Do you see that the number of cases is higher in young people, or is it across generations really?
Well, this is so interesting. So, even though young people have the most diagnoses, rates are rising across everyone, including older adults, right? So, with older adults, I suppose pregnancy in sex ed is less of a focus. So, providers aren't necessarily counseling them about that. Viagra's off license. People are living longer. They're
Oh,
having sex later
yeah.
in life.
Yeah.
Yeah. Dating apps are for everyone. They're being used by all age groups. So we see STI rates rising as well in older populations. Which, I mean, in some ways, I applaud them.
Yeah. Well, you applaud the fact that they're yeah, absolutely still
Yeah,
living a full life, but
but you want them to be safe.
you absolutely do. Yeah. Um, mm.
But that comes as a surprise to a lot of people. Just like a lot of people don't know that many STIs have no symptoms, or they think that you have to be promiscuous if you've gotten an STI, and actually you can have sex with one person, and you can pick it up.
I mean, it's still amazing. I mean, there are, and again, doing this research, there are still an uncomfortably high number of young people that still believe that you can't get pregnant the first time you have sex, or if you're not laying down, or whatever. I mean, you've answered these questions on your
Yeah,
TikTok, for goodness sake, but you think, really? Is he really believe that? But yeah, and it's no, no. He said it was the first time he can't do it. We said if it's in his car, it's fine. Really? It's, it's just you think,
like, what is the car? Is it something about being on four wheels? Like,
I
what is?
know, yeah. It's a bit like lightning. That rubber, but the tires protects you. It's none of that. Isn't that sort of rubber we're talking about, really?
No,
Yeah.
exactly. Yeah, that's quite good. No, but I mean, again, so yeah, we answer all of these questions through our social media, but we do our best to, we welcome any and all questions because we want people to come forward and
Mhm.
ask. So when I first started creating content, I was creating content that I think other doctors and epidemiologists might really like, but in fact, real people have no idea what I was talking about.
Yeah.
And then we realized quite quickly that like if we allow people an opportunity to ask questions in the ways that they normally would, that they would ask their friends, we
Yeah.
could actually give them more useful information and in a way that they could understand. And there's something about social media. There's like a degree of anonymity or removal that makes them feel they can open up. Whereas, when you're sitting across from someone face to face, it might feel a bit intimidating to say things out loud.
Yeah, definitely. And like you were saying before about social media, it's an amazing tool in some ways, and then in other ways, although there are moves around more realistic body shapes and different sizes of things. But generally, if you watch, lots of Americans listen to this, they might know what this is, but we have programs here called sort of Love Island and programs like that, or Married at First Sight, whatever. The people on those tend to be beautiful specimens of humanity according to traditional ideals. Slim, toned. Generally, the women have a reasonable sized chest and a decent butt and a slim waist. The guys have pecs and biceps and all that sort of stuff. And it's still that sort of thing. Well, this is what everybody should look like. And we all know that I don't. Most people don't look like that.
No,
And that's, yeah. It's a shame
no.
that social media does still push the narrative that I guess women in particular have seen from the cover of magazines for many, many years. That there is an ideal shape, and if you're not this ideal shape, then you're less sexually desirable than somebody that is this shape.
Yeah, that's something, it's amazing. People really internalize that from a very young age. And with the
Yes.
advent of social media, they're seeing it more and more. Like, they go home from school, but it's still, right in front of them.
Mhm.
And yeah, it's the challenge with social media, isn't it? Like, it's got incredible reach and has the
Yeah.
potential to do so much good and connect us with people from all over the world. Like, we always see the
Mhm.
positives in new technologies.
Yeah.
But, yeah, it's true. Online, you're seeing a curated persona. So these like filtered and highlighted real versions of people's lives. And so I think even though we all know that, like logically, it's still, I think you can't help but feel like everyone else's life is somehow easier or happier or more fulfilling than your own.
Mm.
And when you're constantly faced with these polished versions of reality, I think we're left comparing them to you know, the unedited version of our own lives. And the comparison can make people feel really lonely, even though technically they're more connected than ever. Yeah.
Yeah, because we are. The statistics show that more people self-report as lonely than ever before. I think most men, well, not most men, 24% of men say they haven't got a friend. I think 17% of men say they haven't got a best friend. It's yeah, and people tend to be going into relationships later. Few people are in relationships, all those things, and connected to that. And you might not have you will have an answer. You have an answer for everything. But I talked to a really interesting professor in Germany a few months ago, and she's a professor of ethics and AI, which is a fascinating topic. And we're talking about the development of humanoid robots and how robots or humanoids and AI are getting more and more realistic. And we're discussing the possibility of, I don't know what the right word is for it really, but a sex bot or a sort of replacement entity that you could be physically intimate with. And her thoughts were that people, even if it's a one night stand or whatever, people generally expect more from a partner than just sex. So she didn't think that sex bots were a realistic solution, if that is the right word, to anything. I don't wonder what you thought.
I mean, I must admit, I don't know much about sex bots, though I will look into it after this now.
It's a rabbit hole. You can't go down with that one, believe me.
I think there is something to be said for the quality of connection,
Yeah.
whether that's, and the depth of connection or the substance of a connection, whether it's
Mhm.
through social contacts or sex bots. Um, I would like to think that people expect more from their partner than just kind of a physical action. Um, Yeah, I think again, it kind of goes back to that definition of sexual health, which is a state of physical, mental, and social well being that enables you to have safe and pleasurable sexual experiences. And I think that goes beyond just the physical act, and it includes things like connection and intimacy and
Yeah.
the emotional dimensions of our relationships, which kind of factor into somebody's overall sexual health.
Mm.
So while I think there's probably a sizable market for them, and I'm sure 100 different uses that people can come up for. I don't know that they're going to replace kind of the in-person relationships with human beings in quite the same way.
Yeah. Because, I mean, ultimately, no matter how realistic they look, they are, I guess, the next advancement of vibrators or fleshlights, whatever. Really, it's something we've had for a while, but these are the next iteration on top of that. But still, you're not going to have that intimate moment or moments that around it. You've obviously spent a lot of your time, whether it's been in the emergency room or in your business or in talking about these particular topics. For a lot of people, could feel fairly overwhelming. I just wondered how you make sure your own mental health and physical health is as good as it should be. Do you take time for yourself to sort of divorce yourself from these topics and just focus on yourself?
I mean, to remember that immersive personality that I have, it makes
Yes.
it really hard for me to switch off.
Yeah.
So I have to admit, I struggle to practice what I preach here. I'm still striving to find a better work-life balance.
Mhm.
So if, for example, so I can get engrossed in a task quite easily, and I'll sit at my desk for hours. But I'll ask myself, like, if I was a friend of mine, would I tell me to just stop and take a break? And if the answer is yes, that kind of helps me follow my own
Mhm.
advice. Um, I suppose and this might be just a result of working in healthcare, but there are things I find I'm grateful for every day. Because we see people who lose their health, their lives, their loved ones often, and so it makes it easier, or it reminds me to appreciate so many things, or the little moments that are easily taken for granted.
Mhm.
I make sure that I sleep enough. I'm an early riser. I'm more productive in the morning. So I make sure that I get to bed early and get enough rest, because it makes a huge difference to how I turn up, both for myself and for, my colleagues, my patients. And then there's my dog, Benzo, who I absolutely love. And actually, taking care of him is probably the best way that I take care of myself. Like I said, I can sit at my desk and just kind of become engrossed in a task and keep working. But taking breaks to, feed him or play with him or take him for a walk kind of reminds me, it gets me up from my desk, away from a screen. And he's a good reminder that self care doesn't have to be complicated. Like, it can literally just be stepping outside and breathing. And yeah. Oh,
Yeah, I'm with you on that one. So we got a dog during lockdowns, first ever dog we ever had, and I didn't have any children. My sister was allergic and stuff, so I'm at home all the time, and my wife's out of work, children are at school, and Juno's our little dog's a cockapoo,
oh,
and she's 4. Yeah, we just got back from Richmond Park, just sort of walking around in the sort of sunshine. But and I love that, and the other thing I love is that no matter how no matter how miserable I might feel, which is sometimes the case, if I've been out of the room for, it can be 5 minutes. If I've gone upstairs and come downstairs, the joy that she shows in, oh my God, you're back. Oh my God, I don't know how you're going to be gone for. I thought I'd never see you again. Just this absolute unfettered joy that dogs have in seeing you is extraordinary, and that I cannot avoid smiling, getting on my hands and knees, playing with her, etc. That it is amazing. Whereas our cat Rose,
oh.
I'll go upstairs and she'll sort of see me. She's like, "Hey, what are you doing here?" But the dog is a real. They just are the embodiment of joy, really.
They're
Uh,
so
yeah,
wonderful.
they
They're
are.
so, so wonderful. Like, honestly, again, I think we get used to kind of ignoring our own needs and
Yeah,
suppressing them, but we won't ignore the needs of
yeah,
something or someone we look after, right? And so, again, taking care of a dog is often a really good way to take care, or make sure that you're also taking care of yourself, even though you're like, oh, like, I'm a caretaker for the dog. And yeah, I think it's entirely reciprocal.
yeah. And a few minutes sort of stroking your dog is worth so much meditation time. She's just in that space where, yeah, she makes us sort of contented snuffles and things. It's yeah. Sorry, this is a dog loving.
No, no, no. Sorry. Yeah, we love dogs. We love
We
dogs.
do. What do you hope for the future of Yoxley? Where might it go?
So like I said, we started with at home kind of
Yep.
testing, because that's what we understood, like diagnostics, treatment, like most providers. And then, through our community, which we built by creating educational content,
Mhm.
we realized that, like, so many people had a need for, not just the physical side of things, but also the psychological and the
Yeah.
emotional. And personalized medicine is the future.
Mhm.
Healthcare is no longer one size fits all. And so there was a lot of need for an empathetic and non judgmental and highly personalized way of getting information from a trusted source. Forgive me, that's Benzo in the background. that you can hear scratching at the carpet. Um, but yeah, so now we've kind of expanded beyond the remote diagnostics and treatments and anonymous partner notification, the remote health services, and now we're kind of expanding into broader sexual wellness that enable people to ask questions. So same kind of questions they would ask me, but again, discreetly and privately to get
Mm.
answers that are specific to them and in a way that they would understand, to create personalized plans, to achieve certain sexual wellness goals,
Mhm.
and to, I guess, keep track of their intimate moments, whether it's physical intimacy, emotional intimacy, communication. Because when you said
Yeah.
communication earlier, you are 100% right. Communication is one of the biggest struggles that people have. Like, to talk about, their needs, their desires, their
Mhm.
wants. And so, yeah, giving them, I guess, the tools with which to kind of log that and then receive insights on it that they can action. So I think we are trying to take a much more holistic approach, but that's personalized to the individual.
Yeah, I think that's super important. My father-in-law sort of worked in stem cell therapy for years and years, and his big thing is exactly that. So it's all about personalization, and going forward, it'll be about personalized healthcare, because it's funny. We'll sort of spend, I don't know, we'll spend £100 on a gym membership each month that we don't never actually go. But the thoughts of sort of spending, £100, £10, £20, £50 a month on our health is something that we struggle with. But I look at athletes. You look at LeBron James and Cristiano Ronaldo, who are famous sports people and sportswomen as well, that have gone on into their 40s and longer because they. I think LeBron James spends $2 million a year on his personal health. Ronaldo spends $1 million a year on his personal health. That's all I have really. It's personal. It's me. It's health. It's how I operate. So that's something you do want, and it's really really hard for the family doctor to be able to do those things, because at my practice they have 5 minutes for an appointment. I go in with I don't know, a swollen hand, and somebody else has come in and they've got ulcers on the legs, and that comes in and everything they see is that 5 minutes. Yeah, here's some medicine, and that's all they can do, and it's no criticism of them whatsoever. But
Hmm.
you almost want them to have a bit like when you go to a beautician's or a health centre where they have a massage room, and they sort of people hire a chair and have. You almost want like a sort of Yoxley part of the room that people go to. Well, this is what they specialise in. It's a holistic view. You've got more time. It's half an hour conversation, and we'll cover this, this, and this. You come in once every 6 months. We keep a sort of track. You can look at it online. You can diarise things. That's where you want it to go, really, isn't it? So it's sort of, we help that sort of at point of need health service with other specialties, because doctors get trained in so many things, but they don't get years and years of training in sort of sexual health. They don't get years and years of training in mental health. They get what they get, which is a broad brush of health conditions. So you want them to be able to connect people with somebody that can have that holistic, broader conversation with them. So yeah, well, hopefully we'll see that going forward.
I hope so. I think they just don't have the time or the capacity to delve or dig
Absolutely.
into things in the way that they might like, right? Just because
Yeah.
the demands on the system continue to go up. And like you said, they've got
Yeah.
5 minutes for an appointment. So
Mhm.
it becomes really challenging. I think, but I think that's what people miss. I think that's what they want, is that sense of being known. And
Mhm.
if they're struggling to be known by their partner, or they're too embarrassed, or the provider doesn't have time to get to know them,
Hmm.
there's something about having that context and that memory, not feeling like you have to repeat yourself over and over to get really personalized advice or personalized recommendations
Yes.
or insights that are specific and relevant to you. Because otherwise, you end up reading 20 Google articles and 30 Reddit threads trying to piece together the
They're
right.
always so helpful. Yes, you end up thinking, "Oh my goodness, either no matter what I have as a symptom, I've got a brain tumor,"
Yeah,
or no, it's extraordinary.
it is. So yeah, but it's also trying to encourage people to be proactive about their sexual self-care,
Mhm.
and not just reaching out or looking after it in moments of crisis, but actually
Mm.
like making it a part of their routine, because it's such an important part of the human experience. We endeavor to be there for people from their first time to their last time and everything in between, because the needs that we have, the sexual wellness needs that we have, they evolve over a lifetime.
I was going to say, what would your closing words be to people? I think you've just done it. I think that's the key word, is proactive. Because I hadn't necessarily thought that before. We sort of saying that most people are reactive when they go and get a diagnosis or ask a question or whatever. But I think having it as part of your general health regime, it's just like anything else, just to be proactive and think of it as your sex life as opposed to anything else. It is. You want to have, as you're saying, people are able to access Viagra and lots of different things now, and sex lives go on for much, much longer. So, yeah, why not get the best out of it?
I think so. I think, and again, it's reminding them that it's not just about, there's the physical act of sex, but there are also things like communication and emotional intimacy and
Yeah.
all of these things that actually play into their overall sexual well-being. So just giving them an awareness of that and how all of those pieces are connected, I think could be really useful. But if your listeners want to check it out, they can go to our website at Ask Danae, so AskDanai.com. Shameless plug, forgive me.
No, gosh, no. I'll put all the links into the notes, and make sure you check out the TikTok, because it's and just be impressed at your ability to answer all these questions with so sometimes you sort of go, so-and-so's asked, and then you go to a very, very sensible answer. So I think and they are, as TikTok is, very sort of short and insightful and just factual. It's the facts. So that's what we need, is the facts, just the facts.
Yeah.
So thank you so much for your time. You've been so generous, and I know a lot of people will get a lot from this. If you reach out and it catches a few people and they sort of think, actually, yeah, maybe I should just go and see what's going on, then that's got to be a good thing.
No,
So yeah, the best of luck with Yoxly. Best of luck with your future, and yeah, make sure you do spend some time, not just with the dog, but with yourself, and don't get too immersed in everything that you tend to touch. So thank you.
no, thank you so much for having me. It's been an absolute pleasure speaking with you.